The reason that we started doing nursing on tour is because we had some fantastic student nurses at my practice at Netherfield House Surgery, and they came up with an event that has sort of inspired us to bring student nurses out in a really innovative way in practice, because it's not been done before. And what we were able to do is show that student nurses could have a massive impact in general practice if we give them the freedom to create events like this. So it was a lot of hard work, but it was very much the student nurses that have done it, and we've just helped them get here, really.
So I think there's this real old-fashioned view of practice nursing as somewhere where people used to come to retire when they were at the end of their career, but actually that's changed. You can have a really advanced career as a nurse within primary care. At the moment we have practice nurses, we have nurse practitioners, and we also have advanced clinical practitioners working within our practices. Real experienced autonomous roles, and these are all available to future nurses within primary care. And this event helps showcase that to students and helps them see that they can have a real dynamic career in the future within a primary care service.
Throughout the typical health check, we will take somebody's blood pressure, we'll check their blood glucose levels with a finger prick, we will do a manual pulse check, and then we'll have some discussions around sort of exercise, alcohol intake, and then we look at family history of cardiovascular disease as well. So I think for me personally, it builds on my skills, my confidence, my decision making. It gives me an ability to explore my own skills as a learning disability nurse, to use those transferable skills of communication, things like that, and apply them to sort of a wider population.
So helping nurses come into GPs, potentially nurses don't know what GP surgeries are about. The hospitals maybe have a higher profile, and GP surgeries are vital to communities, particularly maybe rural communities, which we are. We really, really need the nurses here with us to help as part of the team. They're vital to our team, and to have more nurses come into surgeries as other nurses maybe retire is crucial for us, and it's crucial for our patients.
For GPs to be involved in the project, what it's showing them is the impact that student nurses can have. We know that in the next few years we're going to have a bit of a recruitment problem in primary care, because a lot of our practice nurses are getting set to retire. So we need newly qualified nurses to think about coming into primary care. So for practices, this is almost like a job fair for them, and we're showing the students that these are jobs that are open to you when you're newly qualified. And in Northumberland and in the North East, we have some lovely career start options for student nurses now, like the GP fellowship and the career start programme. So by showing practices what student nurses are capable of, we're showing them what their future workforce is going to be.